Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. It's October, which means it's National Breast Cancer Awareness Month. So many women in the United States are affected by breast cancer every day. So as you begin to see pink everywhere, we have a few guests here to discuss different aspects of breast cancer. We will hear about coping with breast cancer and the emotional effects from a breast cancer survivor, as well as a licensed clinical social worker from Mary Bird Perkins Cancer Center. Our first guest will discuss screenings and diagnostics that are used to treat and diagnose breast cancer. And our first guest is Agabita Rowe from the Women's Pavilion at St. Tammany Parish Hospital. Welcome.
Thank you.
So I think when people think about breast cancer, the first test they think about is a mammogram. Is that usually the first test that you would have to detect breast cancer?
Actually, the clinical breast exam with your doctor is the first test. And just being aware of your breast and looking for signs and symptoms within your breast. But the clinical breast exam is first, and then your mammogram follows.
Can you tell us a little bit about mammograms?
A mammogram is a two-view. It's a straight up and down view, and then it's an angled projection based on your height. And we compress. A lot of people I know don't like the compression, but the better the compression, the better we see inside of the breast tissue.
Okay. How often should women get a breast mammogram?
A mammogram. They should get a mammogram starting at the age of 40, which is what the American Cancer Society recommends, and those are the guidelines that we follow, starting at the age of 40 and annually as a screening.
Okay. For women that are younger than 40, what should they kind of look out for, maybe talk to their doctor about, since they're not getting yearly mammograms?
That's, and actually not just the younger women, it goes for all women.
Okay.
But they look for dimpling in the breast, discoloration in the breast, feeling for lumps, mostly lumps that do not move. A lot of us do have breast lumps within our breast. Inversion of the nipple. Different types of secretions from the nipple. Take note of what type of secretion you have from the nipple and be ready to let your doctor know, because that also tells us something. And pain is not always a sign of cancer. It can be, but mostly it's when something has progressed real far. But most of the time we don't get too excited about pain because a lot of us have fibrocystic breasts. And I call that a condition, it's not a disease.
Okay. How important is the mammogram for early detection?
It's extremely important because a mammogram can also pick up on things that you don't feel, that you don't see. It picks up on microcalcifications, which are tiny little deposits of calcium within the breast. And all calcifications are not bad, but it finds out a distortion within the breast, asymmetries within the breast. It's very important.
Okay, and besides the mammogram, what other screenings or diagnostics are used for detecting breast cancer or other breast illnesses?
Besides mammogram, say for example, if they do see something, they may want an ultrasound, they may want an MRI. We do different types of biopsies, stereotactic biopsies, ultrasound-guided biopsies, MRI biopsies, needle localizations, all based on what they find within the breast tissue.
Okay, and so those come after mammograms?
They always
usually
come always after a mammogram, unless it's a young person, and then they may want to do an ultrasound before they do the mammogram. But all those other tests are after a mammogram is done.
And is an ultrasound less invasive? Is that why?
An ultrasound helps to distinguish between something being cystic and something being solid. Or say, for example, they've had a mammogram and they have little specks within their breast, microcalcifications. They may want to see if a mass is associated with those microcalcifications. But it's mostly to, if it's an additional test, to see if something's cystic or if it's solid.
Okay. Is there anything else?
But sometimes an ultrasound can also pick up on cancers that we don't necessarily see on the mammogram too. So they work hand in hand with one another. But the mammogram is always going to be the first initial test that they get.
Okay. Well, thank you very much. Coming up, we have Jane Ferdenberger from Mary Bird Perkins Cancer Center, a licensed clinical social worker, to talk a little bit about coping with breast cancer and helping out your support system.
Now that St. Tammany Parish Hospital and Ochsner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
Welcome back to Healthy Living. Our next guest is Jane Ferdenberger from Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital, and she's going to talk a little bit with us about coping with a diagnosis of cancer and the support system and different things about coping with the diagnosis. Hi, Jane.
Hi, good morning.
Good morning. Can you tell me a little bit about what you do as a licensed clinical social worker?
Yes, my role at the Cancer Center is to address the non-medical concerns and needs of our patients, what we might formally call the psychosocial needs. And so that runs the gamut from obviously addressing the emotional roller coaster ride that patients and their family members experience as they go through cancer diagnosis and treatment and into survivorship, but also addressing some of the practical concerns and needs folks have. If they don't have transportation to get to the center, if they are having to take time off from work and there's forms to fill out, and just the confusion surrounding, can I work, can I exercise, can I go out with my friends, some of those day-to-day issues that folks experience, particularly with women. They struggle with, how do I talk to my children about this if they're younger women? How do I manage my own stress and still keep a normal family routine going on or maintain my relationships? So I'm here to address their community resource needs, practical needs, as well as certainly their personal emotional needs.
Okay, so how can someone go about coping with a cancer diagnosis?
Well, it's very important, number one, to breathe. And that obviously we're breathing all the time, but we tend to, when we're in a state of crisis, to breathe very shallowly and quite rapidly. And that just increases the stress mechanism in one's body, and that is not healthy and keeps us from thinking. So taking that step back, breathing, practicing stress management, and there's so many ways to practice stress management. Number one, just writing down all those questions and concerns and what ifs, so that when you see your medical professional, your doctor, you have it written down, what's really priority for you. Really important too, while you're waiting for a definitive diagnosis or waiting to start treatment, to go about your daily life. Life does go on. Most of the time, it's not a real immediate crisis to get into treatment. The doctor will say, yes, we have to run different tests. We have to know exactly the tumor type. We need to have PET scans. So it might be a month before treatment starts. So in the meantime, continue to do those fun things that you enjoy. Continue to work whatever you can within your physical abilities.
Okay, and what kind of support system do people need when going through diagnosis and treatment, and what kind of suggestions do you have for that support system? What should they know? What do they need to do to be there for that person?
You know, every woman is different in terms of how she's going to approach sharing the diagnosis with others. Some folks prefer to wait until they really have a definitive treatment plan and really are more comfortable themselves with what they're going to be going through for several months. Others immediately want to rally their support system. Those people to say, look, I've got this diagnosis. I just need your support, your prayers, your friendships. We need to still go out and do fun things. I still need to go to the movies. I still, want to go out after work with my friends, just to show that life still goes on and I still can experience joy each day. With children, frequently, that's a whole separate topic, but children frequently, parents will choose to wait until they know exactly what the treatment plan is and to let the children know, hey, I'm going to go have some treatment that might cause me to feel ill, I might lose my hair, but this is all to help mommy get better. Of course, it depends on the developmental stage of a child to know exactly what to say. And that's certainly something that I'm always willing to chat with our patients about so that they know what to say maybe with their kids. But in terms of other support systems, the center offers quite a variety of support groups for women, for caregivers. There's nothing more affirming for so many people when they're able to come and meet with others who get it, just intrinsically get it, because there's something very personal about having a cancer diagnosis. It's hard to share with somebody who hasn't experienced that. So there's power in coming together. For a lot of people, busy schedules, it's not possible to come to a support group. There are online support groups offered through Cancer Care. It's a national organization, cancercare.org. Livestrong Foundation, they also offer free telephone counseling. So more and more, there's a really beautiful program called Reimagine.me. That's an online psychosocial support format, and all of these are free of charge. So that's another way for people to reach out for support.
Okay, and how important is having support, whether it's from a group, from your family, from someone on the phone just talking to you?
Yes, support, research has shown that those folks who have some sort of support system, and that could be your golfing buddies, your tennis group, it could be your church Sunday school class. It doesn't have to be a traditional cancer support group, but folks who are associated with others tend to fare better emotionally and physically as they go through treatment, as opposed to those who are isolated and alone. They have a harder time coping, obviously emotionally. It's that old Barbra Streisand song, people who need people are the luckiest people in the world. Especially as women, we think we have to be independent and strong and superwoman, and we realize, especially in facing a health crisis, that we do need others, and it's not a sign of weakness to allow others to give their gift of friendship and support.
Oh, wow. Okay. Well, thank you so much for being here.
You're welcome.
Coming up, we have Sandy Matthews, a breast cancer survivor, to talk a little bit about her journey with breast cancer.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our final guest today is Sandy Matthews, the director of the Community Wellness Center at St. Tammany Parish Hospital and a breast cancer survivor. Welcome, Sandy.
Good morning.
Can you tell us a little bit about your experience with breast cancer?
Yes, I'm a pretty long-term survivor. I'm 14 years out. I was diagnosed in 2001.
Okay. That's amazing.
When I was originally diagnosed, I had no idea that there was breast cancer history in my family. No one had ever experienced that before. I have 3 sisters. My sisters hadn't experienced it. My mom, my aunts, nobody. Oh, wow. So I did not think it was a hereditary factor. When I was diagnosed, I went for just a regular screening mammogram, and they found several calcifications, and the radiologist, I knew the radiologist because I do work at St. Tammany Parish Hospital, and he told me, this really doesn't look good, you need to go see a surgeon immediately. He actually called the surgeon from his office, and my journey started immediately. They did a lumpectomy, and then they did a needle biopsy first, and then they did a lumpectomy. I was very fortunate to find out that it was ductal carcinoma in situ. So all of those words, when you're first starting out, it just seems like you're learning a new language. I didn't know what any of that meant. But again, I was fortunate because that is one of your beginning stages of cancer. The cancer cells were still located in the milk duct of the breast. So I was very lucky. They did talk to me about options for treatment. When I was in the surgeon's office and he gave me all of these options, my first thought was, I'm not going to do any of it. And I walked out of his office, walked into the bathroom of the lobby, and locked myself in. I called my boss and said, I have cancer and I'm never coming back. And she said, stay there, I'm coming over. So she came over, brought me back into the surgeon's office, talked with me again. That was my first support person. That was when I knew I was going to need help. I reached out to people. Each person, each woman is different. Some people are very private and they don't need the help. I did. I have a strong family support system and they helped me get through it. They laughed with me, they cried with me. But then I reached a point where I realized I had to be strong for myself. And I did. I started going through my treatments. I did radiology. But as I was doing these treatments, it was 5 days a week for 5 weeks. And I stayed working full time. I did exercise every morning. I went to a health club and did exercise 5:30 in the morning.
Wow.
And then once a week I did yoga. This helped me mentally. It also helped me to get into a positive frame of mind. And I would also say it helped my family because your family members are there for you to support you, but it's hard on them too. When they can see that you're dealing with it in a positive frame of mind, it helps them to deal with it also. So, and some good things came from that. As I completed my treatments, I realized when I was doing the radiation, I noticed the ceiling tiles. I didn't like the way those ceiling tiles looked. I didn't like the pictures that were on the wall. Some of them were crooked. I didn't like the sounds that the machine made. And this was, this was a long time ago, so we've come a long way since then. But as I finished my treatments, I realized I wanted to do something. I wanted people to have a better experience. So I joined the Healing Arts Committee at the hospital. So the women that go and do the treatment now, you're going to notice a lot of different things that help you as you're going through your treatment. We have some beautiful artwork. We have fountains. We have, even when you go to have your mammogram, we have a fireplace. You can sit in front of a fireplace with a warm robe. So it's come a long way, and I feel like that was part of my journey.
Oh, that's awesome. So I know breast cancer has again affected your family recently. Can you tell us a little bit about that?
Yes. Like I said, I have other sisters, and nobody thought this was going to happen, but my older sister, she's 10 years older than me, she's 72, and she just recently got diagnosed. My sister was one person that we used to argue with all the time because she would not go have a mammogram. She just said, I don't want it. If I have cancer, just let it do what it needs to do, and I'll go when it's my time. So she went for a chest x-ray. They seen something and asked her to do a mammogram, and she found out she had breast cancer. It was a struggle for her in the beginning. She fought it. She didn't want to do anything either. But now she has just completed her 3rd chemo. She's doing great. She's in a positive frame of mind, but those first few weeks are just, I think that's some of your hardest. It's just devastating to learn all the things that you're going to be going through. She did lose her hair, but she went right out. She bought a wig. She bought the little turbans. And I have to say, she looks cute. She really looks cute. She puts her makeup on and her earrings, and it hasn't stopped her. She still goes out and she does things out in the community. When she first gets her chemo, she doesn't. Most people have to stay inside for a little bit and isolate themselves from large crowds. But once she gets past that first week after chemo, she's out and about again. So
That's
the
awesome.
treatment has come a long way.
Oh, wow. So do you feel that positive attitude is what helped you get through it and can help a lot of people to not only get through treatment but survive?
Yes, I do. And my husband also went through cancer. He went through throat cancer, and I've never seen anybody as positive as him, because that was, throat cancer is extremely difficult treatment, and he had such a positive attitude, and it helped. It helped him, it helped me, and I definitely think that helps. And if you can find things to put your mind, channel your mind into other things, whether it's redecorating your room, or cooking. Pretty much cooking's out. Most people can't tolerate the smells and the flavors of the cooking, but if you can just find some kind of project that you can put your mind on.
Okay, well, thank you so much for being here and sharing your story with us. I really appreciate that. Thank you to our other guests for being here. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.